From the News Channel 5 network, this is Openline.
Hello everyone, I'm Scott Arnold and welcome to this Wednesday night edition of Openline. So glad you are with us for the next hour because it is truly going to be fascinating, especially if you're having issues with your eyes or you want to find out a brand new way to take care of cataracts. It turns out the first of its kind laser cataract surgery happening right here in Tennessee, and we have got the doctor who's now performing these procedures and the second recipient of this unique procedure. So let's bring in Dr. Ming Wang and Shirley Brees, laser cataract surgery recipient. Good evening to both of you. Good to see you, sir.
Good evening, Scott.
Thank you for being with us. We appreciate this. So, laser cataract, you were telling me before we went on the air that it's being performed in a new way, and you're actually the first ophthalmologist in Tennessee to be doing this surgery. Why?
We're very excited. Not only we are the first in the state of Tennessee, we also are the first in 8 states surrounding Tennessee, including Tennessee. And this is the first year this technology has become available, this laser cataract surgery technology. And among 8,000 cataract surgeons in this country today, very small number, about 10 or 20 of them, the doctors have this leading technology. So we're just very excited to be able to put Tennessee on the national map as a center to have this latest laser cataract surgery technology.
Absolutely. And before we get to Shirley to ask her about her vision, how she's doing, why did you want to go to the laser versus some of the more traditional methods that you have been using over the years?
Yeah. You know, Scott, that 15 years ago, a revolution took place in vision correction surgery. Prior to that, we were using blade to do RK surgery. And then laser became available. So vision correction surgery went from blade, RK, to laser, LASIK. And LASIK has really revolutionized medicine and has enabled millions of patients to be able to be freed of dependence on glasses or contact lenses. So 15 years later today, a similar revolution, this time in cataract surgery, is taking place. Cataract surgery today now is also going from blade to laser. And I think this is going to be even more, having a bigger impact than LASIK itself on the lives of millions of people, because there are 5 times more patients who receive cataract surgeries every year than LASIK surgery.
Really?
And also cataract surgery is a medically indicated surgery rather than LASIK's totally elective. And lastly, population is getting older. So everybody wants to be younger and feel younger, look younger, seeing younger.
Absolutely. Before we get to the phone lines here at 737+, I want to bring in Shirley here. Shirley, when did you have your laser cataract surgery?
I had my left eye done December the 1st, and my right eye was done December the 6th.
Okay. And you realized at the time you were probably like the second person in line to do this. So were you kind of nervous trying this new procedure out?
Maybe slightly, but I trusted Dr. Wang to have a good bit of knowledge and understanding of how this would work. So he made me feel at ease about having the surgery.
Okay, so did you have cataracts in both eyes or just one?
Both.
Both. And so what point was it, or what was it like for you? I mean, was it, you having a hard time seeing?
Particularly at night, and especially if it was raining. That's made my vision very, very difficult to see when I was driving, because the lights are like starburst and it's difficult to see the white lines, and your perception is somewhat off. And so I realized that on one of the evenings when I was driving home from work and we had a lot of rain and in November, that I really needed to make another appointment and go back and see Dr. Wang, that my vision had gotten considerably worse. And I didn't feel comfortable driving at night.
No, absolutely. So take us to the point where you're in Dr. Wang's office and then he's like, what about laser? What did you think?
That's what he said, and at first I'm like, wow, that's
different.
That's different. That's really exciting at the same time. So, so I said, okay, I'll do it, and I would like to be your first patient or second patient to experience this. So, so I agreed to have the laser done.
Okay, and Dr. Wang, with her particular case, I know you did one before that, but what were some of the issues with her eyes? And is it common to have one person have cataracts in both eyes, or is it just one typically?
Actually, Scott, most of the time the patient have cataracts usually in both eyes, because cataracts are actually normal aging change.
Okay.
It's as normal as wrinkles. We all develop wrinkles after we get older, and if you live long enough, you all develop cataracts. So that's a very normal process, and typically affect both eyes. And what's surely related to you is very typical of our cataract surgery patients. Start having problem driving at night, seeing in dark, or seeing difficulty reading in a dimly lit environment such as restaurant, or seeing halo starburst. So it's very typical. And what is not typical in this case is traditional cataract surgeries are performed with a blade. So it carries with it all the variabilities and the risks of a blade human operation. And since surgery is eye surgery, you want to be as precise, as safe as possible. So we were able to introduce this revolutionary technology, laser cataract surgery, for the first time in Tennessee, and being able to perform the whole surgery for Shirley. And now we have about a dozen patients now who had laser cataract surgeries, all with a laser. That's very exciting.
Yes, absolutely. Okay, we want to pause Shirley's story here for just a second. Let's get to the phone lines now at 737+. Jackie is on line 1. Jackie, what do you have to say?
Hi. Yes, I had laser cataract surgery performed by Dr. Wang yesterday on my left eye. And last night, I rested very comfortably after surgery, and I could not be more pleased with my outcome. And I will have my second eye done next week. Now, I live in Clarksville, and so I'm so thankful that we have such a premier world-class physician within 50 miles. And all I can say is Dr. Wang and his staff are just consummate professionals, and you could just feel how much they care about you having a good outcome. I just had a quick question that I thought it might help other people. I wanted Dr. Wang, could you explain how this procedure is less invasive for a patient like me?
Yes, Jackie. First of all, thank you very much, Jack, for coming for calling and to sharing your experience. And we're excited for your second eye coming up. And as I related to you today, that you are among the first dozen patients now in the state of Tennessee to have laser cataract surgery. And the main difference that you're experiencing with laser cataract surgery versus traditional blade cataract surgery is precision and safety. Because rather than a blade operated by human hand, which carries with it all the inherent risk and the variations of human operation, and the blade is a sharp instrument, and depends how the doctor uses, sometimes can cause problems because this eye is a very small, dedicated, precise structure. But with the precision and the reproducibility of laser, we really carry this surgery, improve the quality of surgery to entirely new, unprecedented height. And as I said earlier, a similar revolution took place in vision correction 15 years ago. There was RK blade to LASIK. Now today in cataract surgery, we're also going from blade to laser and for cataract surgery. So it's really improved the precision and safety, and also reduced the healing time for our patients.
Yeah, and Jackie, let me ask you, what was the surgery like? These are questions people out there might want to know. I mean, did you have to be put under anesthesia or twilight or anything like that?
Well, I also, plus having the cataract surgery, I opted to have the Forever Young lens. So the first part, I was not under anesthesia. Simply felt a little bit of pressure when the laser went down and like docs, but nothing really. They were all of his staff was right there. Dr. Wang thoroughly explained as he went along, so I felt very comfortable. Then I got up, I walked into the next room, and then they gave me a little bit of anesthesia, and they proceeded on with the lens. And like I say, I came home, I slept and rested very comfortably last night.
Wow. So she was able to get up and walk around right after.
That's right. Yeah, she's pretty much going back to doing like her regular activities today.
Now, what's the recovery time with laser versus the traditional method? How does that differ?
Faster. Traditional blade cataract surgery, as I said, carry with it variations and inaccuracies of a blade operated by a human hand. With laser, we're able to pre-program the laser. We're able to basically draw on the computer screen exactly where the incision will be. And what's most magical is traditional blade surgery that as an eye doctor, you look down, you see an eyeball. What you see is what you get. But with laser cataract surgery, we're able to take cross-section of the eyeball, just like a CT scan, this is called OCT, cross-section of the eyeball, and unfold and put on the computer screen. So I can see the whole cross-section of the entire eye and direct the laser beam to exactly where it is. Then guess what? No blade, no hand operation. I just step on the pedal, and all the incisions and lens fragmentation, all the important aspects of cataract surgeries are all done on the computer screen, designed.
Wow.
Computer precision.
That is fascinating. Okay, Dr. Ming Wang is here tonight along with Shirley Brees. She's the second laser cataract surgery recipient. We're going to take more of your phone calls at 737+ and talk to them when we come back. So stay with us. Welcome back, everybody, to Open Line on this Wednesday night. We have got ophthalmologist Dr. Ming Wang and the second laser cataract surgery recipient, Shirley Brees, joining us tonight. We're taking your phone calls about this brand new technology that for the very first time has come to Tennessee, and Dr. Ming Wang is performing these cataract surgeries. Let's get back to the phone lines now at 737+. Roger is on line 2. Roger, what's your comment or question?
Yes, sir. What it is, it don't have to do with cataract, but I'm 62 and I'm a retired state employee and everything, but I got, and I've got I wear glasses and they're bifocals, and real quick, when I take my glasses off, everything is out of focus, whether it's a foot away or 100 feet away. It's completely out of focus. All the colors are correct, but if I didn't wear my glasses driving, I could not see the speed limit signs. The red lights would be all jumbled up and fuzzy. What kind of vision is that with my glasses on?
Well, Roger, that based on what you described to me, most likely you have two conditions. One is presbyopia, which is a condition that affects anyone over age 40, 45. So you're at age 62, you're certainly affected by presbyopia, or in the layman's term, old eyes. As we're getting older, you have the old eyes. And second, it also is like you're developing some early cataracts as well. And what we are about tonight is to educate the public about this wonderful brand new technology called laser cataract surgery. And we performed the first laser cataract surgery in the state of Tennessee last week. Actually, we performed the first 3D laser cataract surgery in the world last week. So these new technology can enable us to see better and longer. So we'll be delighted to see you, to evaluate you, Roger, between presbyopia and early cataract, see which condition you have and what's the degree of that condition, and formulate the optimal treatment plan. We'll be delighted to take care of you. You can call us.
So you would say, like, especially if he's having problems focusing, you know, he definitely needs to contact somebody. Yes. to get help or something like
Absolutely.
that. Okay, fair enough. Let's get to Deborah on line 3. Deborah, what's your comment or question?
My question is, I am a keratoconus patient, and I was wondering if I developed cataracts, could I still have the entactic surgery with glaucoma?
Good question. And so, Deborah, you have a condition, it's a corneal condition called keratoconus, which is a genetic condition that over time your cornea gets weaker and weaker and sags forward, causing progressive loss of sight. I happen to be not only a cataract specialist, a LASIK specialist, but also a keratoconus specialist, and I just published not long ago a textbook on keratoconus. We'll be delighted to see you. Our treatment options for you include in-text procedure, which you mentioned, and we have a new cross-linking procedure coming up to stabilize your cornea. And for patients also with concurrent glaucoma and the cataracts with keratoconus, we do need to see you and evaluate all these conditions and find out what's the optimal time for the treatment of the cataracts. Cataract used to be that we wait until the very end stage of the disease to treat. Not anymore. We treat the disease today in modern medicine at the optimal window, not too late, but certainly not too early, but certainly not too late. Optimal window when the benefit to risk ratio does make sense for a surgical intervention. We'll be delighted to see you.
Deborah, does that make sense? Any more questions?
Oh, that would be fine. Thank you so much. Y'all have a blessed night.
Hey, you too.
Welcome,
Thank you
Deborah.
very much. Let's get to Carla on line 4. Carla, what do you have to say?
Hello?
Hi, you're on the air.
Okay. I just want to ask Dr. Wang, I have glaucoma, and I had laser treatment for that, but it seemed like the laser treatment, to relieve the pressure, seemed like the laser procedure made my eyes worse. I cannot see as far as I used to see and as clear as I used to see. So I went back to the doctor the other day, and he said he could see some small cataracts developing. So is there anything, right now I'm on just on eye drops. Is there anything you can do for glaucoma?
Yes, so you have two conditions, glaucoma and the cataracts.
Yes.
And very often these two conditions do go hands in hands. So with regard to glaucoma, of course, medical treatment, what you get in the eye drops, that's the correct treatment. You have laser treatment, sometimes can also help relieve the pressure, or surgery at a more advanced stage. At the same time, we need to recognize that treating the cataract, taking the cataract out at the appropriate time, also will help treat the glaucoma. In fact, many of our patients who have, like you, have glaucoma and the cataracts, and if their cataract is medically indicated to have surgery, we will remove the cataract. In many of those cases, we actually lower the pressure because of the cataract surgery, and that help treat the glaucoma. So we'll be delighted to see you, to see whether that's the right route to take care of your cataract and continue your glaucoma care.
Okay. And another question on that.
Yeah.
What is the normal pressure for glaucoma? Because mine running 21 and 22.
Yeah.
What is the normal pressure?
Under 21 is normal pressure, but in some patients we want to control in the teens. So it depends on the patient.
Oh, okay. I was wondering. Thank you.
Hey,
You're
thanks for
welcome.
calling in. We appreciate it. Let's get to Lee on line 5 now. Lee, good evening.
Hi, how are you?
Doing great.
Yes, sir. I wanted to ask the doctor, I'm in my late 40s, and it seems like the last few years, the light, sunlight especially, and even bright lights in the house sometimes make I'm really sensitive to the light. As I grow older, it seems like it gets a little worse. And my mom, she was 78 when she passed away, and she was very sensitive to sunlight and a bright light in the house. Is that hereditary, or is that just like, with most everybody as they get older? What do I need to expect and to do with that? Thanks. Thank you so much.
You're welcome, Neil. And that's a good question. And you're a little bit young for cataract surgery, because typically cataract surgery is patients in their 60s and 70s and 80s. However, with a family history like that, sometimes in certain patients with family history, their cataracts can occur earlier than average age. As I said earlier, anybody over age 40, 45, 50 start to have aging change of the lens. So with your light sensitivity and inability to see at home and a certain lighting condition, it is possible you are developing some cataracts, especially you have a family history of similar eye problem. So what we should do is see you and perform a full evaluation to see if, because your family history, are you developing the genetic form of cataracts which occur earlier than the average age of 60, 70, 80, and to see if we can help you. If we can, then we've got the right technology for you. Tonight we're talking about laser cataract surgery. And we are performing cataract surgery now with laser with no blade. And we are the only center in the state of Tennessee that offer that laser cataract surgery. We'll be delighted to see you.
All right, Lee, we hope that helps. Let's get to line 6. And Michael, what's your question for Dr. Wang?
Well, I've seen for years in Tennessee about the Wang Foundation. I just wondered how much the percentage went to patient care and what percentage went to advertising. Thank you.
Okay, so you're talking about the foundation issue. The foundation, we have a charity foundation to help blind patients, and the foundation is a 501c charity foundation, and it helps patients, basically anybody who needs medical care and does not have a job or have insurance, and if their income meets the federal guideline that below the poverty guideline, that they do satisfy the financial need to needs help, we will provide surgery free of charge. And it's a foundation actually consists of 30 eye doctors. We share the work, and today the foundation has been in existence for about 10 years now, and today we have helped patients from over 40 states in the United States and patients over 55 countries with all side restoration surgeries performed free of charge. And in terms of my percentage of time that I devote for foundation work, and it depends. Basically, every day I see patients do surgeries, and sometimes basically every day, nearly every day or every other day, we have patients come in who are foundation patients. And we have, as I said, we have team doctors to take care of all these patients. And so in terms of advertising, foundation doesn't itself has an advertising budget because it's a charity foundation. So we basically, we're fortunate. We have once a year annual eyeball event to raise money to help those. As I said, all foundation doctors donate our services free of charge. Thank you.
And real quick on that note, and I don't want to steer too far off of the subject, but with healthcare reform and all the craziness going on with insurance, and are you seeing that more and more these days, like most doctors that are Medicare and Medicaid, where you have people that have these vision problems but they can't afford procedures? Or I mean, is there more charity care going on now because people are just having issues with healthcare in general? Yeah,
I think our nation is going through a very important phase of trying to figure out how can we provide care for the underserved, yet not to bankrupt our country financially. First of all, there is indeed a need. 15% of the United States population do not have health insurance, and that's a real problem. And second, our health system is financially overworked and overburdened. So we do not have extra money to do the things that we like to do. So how do you provide solution care for those underserved at the time of financial crisis and not very much financial resource available? I feel, my personal opinion is that perhaps the real solution comes not by imposing higher taxes or force people to do things, because this is, after all, the great nation of freedom and choice, but to encourage everybody to be volunteers, encourage volunteerism. Because if people can, I think all of us want to, in many different ways, want to help a fellow human being. The challenge is to build a structure, a system, so that everybody can chip in a little bit to help other fellow human beings. And that's what we did as a Side Restoration Foundation. We built a foundation, and every day they walk in, if they need help, they satisfy these 3 conditions: no health insurance, truly need medical care, and income below poverty line, and we'll take care of them free of charge. And I just couldn't imagine that if all specialties, not just ophthalmology, all different doctors, different fields, all healthcare professionals, all do something like this, we can really, together, we can really make a difference to reduce our nation's financial burden to care for the poor.
All right, we'll take a quick break. More of your phone calls at 737+ when we come back, so stay with us. Welcome back, everybody, to Openline on this Wednesday night. Ophthalmologist Dr. Ming Wang is our guest, along with Shirley Brees, the second laser cataract surgery recipient. It's a brand new service offered right here in the Tennessee area for the first time by Dr. Wang. And Shirley, I wanted to ask you, when you were thinking about getting the surgery done, what sort of homework did you do, if any?
I cannot say that I did a lot of homework because I was already a patient of Dr. Wang's and had already valued his professionalism and the helpfulness of his staff. But in saying that, I did ask some of the physicians that work in my clinic, you know, tell me about some physicians in the area that do cataract surgery, because I think I'm going to be needing some cataract surgery, and this was, you know, several months in the past for this year. So there's a lot of opportunity, I think, to talk to your own family physician about who they work with that they would suggest, as well as talk with your friends, find out who they have used as their cataract surgery and what type of surgery they had, what their success was with that, you know, how they felt about it. So those are some things I would do as a professional, and that I always do. I always ask other physicians or my colleagues, you know, what do you think about this physician or that physician, or who have you used? What has worked for you? And
after the surgery, you know, how long was it before you went back to work?
Oh, I went back to work the next day.
Really?
I drove to Dr. Wang's office that morning because I had surgery on Thursday. So I drove to the office on Friday morning, and then I went to work for a few hours and worked that day.
So was it relatively painless?
It's painless. There's no pain.
Wow. And Dr. Wang, how does this differ from, you know, the typical cataract surgery? Is recovery time much quicker with the laser versus traditional methods?
Yes, the main advantage of laser cataract surgery versus traditional cataract surgery, which uses a blade, that it's more precise, safer, and what we have found that is the speed of recovery is much faster. And like Shirley and other laser cataract surgery patients, we found that they went back to work the next day, such as Shirley did, and with minimal discomfort during the surgery. And the other thing I want to mention briefly is that it's a new technology, and we're very excited to be the first in the state of Tennessee to have it. And also currently the laser we use, called LensX laser, is the only laser approved by United States Food and Drug Administration to perform cataract surgery. So LensX laser is the only laser approved by FDA to perform cataract surgery, and we have the only LensX laser in the state of Tennessee.
Excellent. And this might seem like a simple question, but exactly what is a cataract?
That's a good question. Sometimes patients get confused. What's the, you know, myopia, hyperopia, astigmatism, cataract? So basically, myopia, hyperopia, astigmatism, these are what we call refractive problems. So those patients need glasses to see well. Typically, they receive LASIK surgery from age 20 to about 55, 60. So that's LASIK surgery. As I said, 15 years ago, surgery went from RK to laser, LASIK. That brought a revolution. Cataract surgery involves an older population from 55, 60 onwards, 65, 70, and patients have opacity in the lens inside of the eye. So that's why all of these lasers that are used for the outside of the eye, such as intralaser or other laser we know for LASIK surgery, does not apply for cataract surgery, because if laser does not go into the eye, there's no way to treat cataract, which is lens opacification inside of the eye. So this is a different type of laser altogether, LensX laser, as I said. So it goes into the eye, treat this lens opacity, remove it, and replace with artificial clear lens. So that's cataract and cataract surgery.
And this is a shot of one of the surgeries?
Yeah, this is a shot of one of the first laser cataract surgery in the state of Tennessee. And as I said, this is a shot of the laser, LensX laser, which is made by Alcon, and it's the only US FDA approved, fully approved laser for performing cataract surgery. And all other lasers at this time, including intralaser and all these lasers used for LASIK surgeries, are not approved by FDA.
And what sort of training did you have to do to go and learn this?
Yeah,
it's feel comfortable with it.
This long story, but very briefly, that I was very lucky because I was a laser physicist before my medical career. I got my doctorate degree in laser physics and finished postdoctoral training at MIT. Then I decided to be a professional student and went on to get my second doctorate degree, this time in medicine at Harvard. So today's medicine is very high-tech. So it's a combination between high-tech and medicine. And the doctors who truly have the knowledge and expertise on both sides of the story, the technology and the medicine, can truly deliver the quality of care utilizing high-tech. And I've been always working with lasers all my life. I built many lasers during graduate school, and I introduced the bladeless laser LASIK to the state of Tennessee 10 years ago, and was the first one to perform the bladeless all laser LASIK. Now, 10 years later, we're excited to introduce the bladeless all laser cataract surgery to the state of Tennessee.
Okay, excellent. Let's get back to the phone lines now at 737+. Nick is on line 7. Nick, what do you have to say?
Yes, hello, Doctor. As you mentioned earlier, just a few minutes ago in the show, that you performed Tennessee's first laser cataract surgery.
Yes.
And I was able to read a lot about it on your website and also watch a LensX video there, which was very helpful in understanding the procedure. But I've been hearing on the radio this past week something called eye cataract surgery by Dr. Loden. I'm curious what that's about, and if you were indeed the first to perform the Tennessee's first laser cataract surgery.
Okay, Nick, thank you for the question. I think that's a very important question, and we need to clarify. There's a bit of confusion now in the public, different doctors performing different, and who did the first laser cataract surgery in the state of Tennessee. And following are the facts, and which can be verified through websites of companies and through United States Food and Drug Administration. First, LensX laser, which is the laser I mentioned, the one that you saw on the photo, is the only laser approved, fully approved for cataract surgery in this country. So at this time, there's only one laser approved by US FDA for performing cataract surgery. That's the LensX laser. Second, as I mentioned earlier, we have the only LensX laser in the state of Tennessee. Not only Tennessee, but also 8 states surrounding Tennessee as well. We're very excited about that, to be able to put Tennessee on the national map as one of the first in the country to have the LensX laser to perform laser cataract surgery. And number 3, I'm aware of other surgeons and saying that having different lasers performing cataract surgery. But as far as I know, that all these other lasers basically treat the cornea, meaning making cornea cuts, incisions, treating the cornea. Does not actually go into the eye. And since a human lens is a structure located inside of the eye, it's very difficult to imagine any laser that stay on the outside of the eye, such as intralaser, those lasers that FDA approved only for LASIK, can actually treat cataract, which is a lens condition inside of the eye. So, as I said, we are indeed the first center in the state of Tennessee to perform laser cataract surgery, and the LensX laser is the only laser approved by FDA today in this country to perform cataract surgery, and we have the only LensX laser in the state of Tennessee.
Let's move on now to Mike on line 2. Mike, what's your comment or question? Or Mary, excuse me, Mary. You there?
Oh, I was had traditional cataract surgery years ago and ended up having some scar tissue, which has been removed. But I was wondering if you could, if you've had the traditional, if you at some time in the future can have the laser, and is there any problem with ever with scar tissue?
Good question. It is true that after cataract surgery, one can develop what we call scar tissue behind the lens implant, which does require laser treatment, and we do have that laser treatment. And so that could occur for both traditional or laser cataract surgery, because that's part of wound healing. And sounds like you may have some of those problems. We'll be delighted, Mary, to see you, because we do have the laser to remove the scar tissue and after cataract surgery and to improve your sight.
Thanks for the phone call. We appreciate that. Let's get on to line 3. And Joe, what's your comment or question for Dr. Ming Wang?
Thank you for taking my call, Nick, you and Dr. Wang.
Yes.
I've had extensive cataract surgery already in my right and left eye, and I'm almost blind. Dr. Goodman and Trent Wallace was my surgeons, and I tell you what, they got me where I can't hardly see at all. I've had a shot put in the left eye on account of glaucoma. The right eye has been
the disc has been replaced in it 3 times, and I've had the first one shifted, the second one had fluid on it, and hey, they've almost put my eyes out. Can you help this procedure, please, sir?
Yeah, you've got a very difficult condition because it sounds like you have a retinal problem. And my specialty is actually front part of the eye, meaning cornea for LASIK surgery and the lens for cataract surgery. But there's a whole different specialty at the back of the eye, the retina. So you are in good hands, though. These doctors you mentioned are excellent retina specialists, and so I'm so glad you are under their care, and you're in the right hands with these injections, and they may have possibility to stabilize your vision. Unfortunately, these injections for these retinal problems do not improve the vision too much. That's the state of technology at this time. But please be reassured that you're in good hands, in those good doctors' hands.
Okay, more of your phone calls for Dr. Ming Wang at 737+ when we come back, so stay with us. Welcome back, everybody, to Open Line on this Wednesday night. Laser cataract surgery is our topic. Shirley Brees is the second recipient of laser cataracts. And Shirley, in your case, like, when did you know, or when did you think you're starting to have a problem with your vision?
I started to have a problem with my vision around the first part of this year. I would say in March or April, when I had gone in for a regular routine vision check. And some of the complaints that I had was difficulty reading signs, really starting to have a lot of problems driving at night. And that's when the person that was checking my eyes, the physician, said, you know, I think you have the beginning signs of cataracts, but you know, they're not to a point where you need surgery right now. You can still read with your glasses that you have, so you're okay. So you're not a candidate at this point. So then I went on through the year and noticed that, particularly when with the time change, that's when I actually began to notice such a major change in my vision, and that I thought I was beginning to have some real issues that were disturbing to me that I thought needed some medical attention.
So, I mean, the bottom line is Dr. Wang, especially, it's like when you have these issues and they simply don't go away. They become almost a way of life for people like Shirley. That's when you know you need help. And then also, you know, what if you've had LASIK? You know, would you be then a candidate for laser cataract surgery? Yes.
If a patient had LASIK in the past, when they were younger, and then they got older, they have cataracts. Cataract surgery on the previous LASIK patient is more difficult to perform because lens calculation is trickier. And we do believe this new laser cataract surgery is going to truly make a difference, particularly in this patient, subset of patients who have previous LASIK surgery. And to overcome the difficulty, to overcome the challenge, to make cataract surgery more predictable, and especially for the post-LASIK patients. And this is where the technology truly shines for the more difficult cataract surgery, such as in the post-LASIK patients. So we are very excited. I think laser bring on to the cataract surgery, just like laser brought to LASIK many years ago. It brought the revolution. Now it's bringing another revolution affecting a much bigger segment of population.
Now, with the laser cataract surgery and say Shirley, like, how long will it be, or will she ever have to come back and need cataract surgery again?
No, she will never have cataracts ever again.
Great.
Yeah.
No, that's awesome. Okay.
And this is one of the things that made me really excited about having the laser cataract surgery, because I am a LASIK patient in the past. And so I did have some concerns, and that was one of the things that made me aware of the fact that cataracts can come on at an earlier stage once you've had the LASIK surgery.
Okay, let's get back to the phone lines now. Let's get Sarah on line 4. Sarah, what's your comment or question?
Cataracts can come on earlier. Did you say Sarah?
Yeah, Sarah, you're on the air.
Yeah.
Hi.
Okay. In November of 2010, I had a cataract removed on my right side eye, and
yeah, turn down the TV because it's like, you know, echoing. How about we'll go back to Sarah in just a second. We'll get to Faye on line 6. Faye, what's your comment or question for Dr. Wang?
This is Kay.
Well, hi, Kay.
Jack Bradley is a patient, just had surgery yesterday. He was so anxious about having this surgery, and I I'm calling just as a family member to say that the level of care that's received there is excellent. You're not just a number, and every question we had was answered. It didn't matter if it was something that we considered very important, but my husband had some hereditary conditions of the eye that needed to be dealt with, and I just appreciate Dr. Wang and the nurses there at the surgery center.
Hey, Kay, thanks for calling in. I appreciate. From what I understand, well, I mean, from my own doctor, it really matters what the staff is like. I mean, of course, it matters what the doctor's like, but so many times, us patients, we deal with the staff probably more than you, and so having a great staff, a caring staff, is just, you can't put a price tag on that.
Yes, we feel that in modern medicine, not only you need to have the best technology, best doctor, but also you need to have the best service. And that's what we strive to provide, the best service as well.
Excellent. Okay, I thought we were going back to Sarah, but she's not there. Let's get to line 3 and Evelyn. Evelyn, what's your comment or question for Dr. Wang?
Yes, Dr. Wang.
Yes.
My son was born legally blind. He's an albino, and I was wondering if there's any surgery that you could do to help him.
Evelyn, albino is a genetic condition and reflected in the lack of pigmentation. At this time, we do not have any treatment for albinos. There are active research in the gene localization and mutation detection. And I hope in the not too distant future, we may be able to diagnose albinos better and perhaps have some gene-based treatment.
Okay, thank you for your phone call. Let's get to line 7 and Marie. Marie, what's your comment or question?
Hello, my question is, I saw your ad in the Green Hills newspaper, and I want to know if you wear reading glasses, can you have the surgery done to help you with reading?
Good question. What your question, Maria, is you're talking about is the condition called presbyopia. As we get older, we have to push things further and further away to read. And this condition is called short arm syndrome. So your arm, you feel like your arm's getting too short, but actually your arm's okay, just your eyes cannot focus on things up close. We are one of the few centers in the United States today conducting a US FDA clinical trial, a new surgery. This is not a laser cataract surgery, it's another new surgery we are doing research for to specifically help patients before they develop cataracts, if they're already developing the reading difficulty, to help restore their reading sight. And we have performed the most number of these new clinical trial reading vision surgery in the country. And as I said, at this time there's only a few centers in the United States, in Chicago, New York, California, Nashville, and one or two other places. So patients throughout the United States have to go to these few places to have this new research surgery for presbyopia. So if you're interested to get rid of your reading glasses, we'll be delighted to see you every first Tuesday of every month. We have a seminar, educational seminar. You're welcome to come, and we bring patients in to educate patients about the benefit and the risk of all these new surgeries.
All right, Marie, thanks for the phone call. Let's get to line 2 and Ray. Ray, you're on the air. What do you have to say?
Hello, I was calling to ask a question about the family history of maybe having glaucoma. May have been diagnosed with having early onset glaucoma, and I was wondering if it still would make me eligible for the LASIK surgery.
Yes, glaucoma. Having family history of glaucoma is very important to make sure before we consider any surgery at all to properly take care of the glaucoma. So you need a regular eye check, and we need to check your pressure, optic nerve, visual field to properly take care of the glaucoma. If glaucoma is properly taken care of, and if you have cataracts, and certainly we will perform surgery and using laser cataract surgery, that's what we're talking about today. As I said earlier, we performed the first laser cataract surgery in the state of Tennessee recently. We'll be delighted to see if you're a candidate for the laser cataract surgery. But also LASIK surgery for younger patients, dependent if you have developed cataracts or not. And that's also another possibility. We'll be delighted to see you, certainly.
All right, Ray, thanks for the phone call. We appreciate it. Okay, in the last 3 minutes of this segment, I want to ask Shirley one more time in terms of You know, if people are out there watching this thinking, you know, I need to get this done, you know, why should I do the laser versus more traditional methods? What would you tell them?
I would tell them that what I've learned about the laser is that the recovery is faster and it's more precise. And those are some things that would help you decide on doing laser versus the bladeless.
Mm-hmm. And you stand behind this 110%. I mean, you think this is the future of this type of surgery?
Yes, as I said, the best way to understand the impact of laser cataract surgery, which we'll talk about tonight, is we have seen similar things happen 15 years ago when LASIK came on board, and it really revolutionized the medicine and had enabled millions of people to be freed of dependence on glasses and contact lenses. So a similar revolution taking place now today in cataract surgery. It's going from blade to laser. So, and its impact on people's life will only be greater because 5 times more patients are getting cataract surgery every year than LASIK, and cataract surgery is a medically indicated procedure. LASIK is electively totally choice of patients. And as I said, we're very excited to be the first in the state of Tennessee to perform laser cataract surgery and to have the LensX laser, which, as I said, is the only FDA-approved laser for performing cataract surgery, and we have the only LensX laser in the state of Tennessee, and to be able to offer the top quality, state-of-art technology to the patients of Tennessee and from all over the country or around the world.
And it's amazing that the next day, like Shirley was back to work.
Yes, yeah. You see the speed of recovery. I mean, it's amazing. You just out of commission for just one day, the day of surgery. We use small incision, no injection, no patch. Now we use laser to perform cataract surgery.
Okay, excellent. All right, we're going to take one more break. We'll be back to wrap things up with Shirley Brees and Dr. Ming Wang, so stay with us. Okay, we're wrapping things up on a Wednesday night. Dr. Ming Wang, your final thoughts?
Yes, today we have the opportunity to share with the audience about laser cataract surgery. And the significance of this new technology, laser cataract surgery, is, as I said earlier, 15 years ago we have LASIK, went from blade to laser, which really revolutionized the medicine and enabled millions to be freed of dependence on glasses and contact lenses. Today, 15 years later, a similar revolution is also taking place, this time in cataract surgery. Cataract surgery now is going from blade to laser. And currently there's one laser approved in the United States to perform cataract surgery, and that's the LensX laser. And all the other lasers have not been approved fully for cataract surgery. One question earlier was asking about lasers that treating intralace to treating the cornea, making cornea incisions. These are not really laser for cataract surgery because a cataract is a condition inside of the eye, and laser like that sitting on the outside cannot treat inside of the eye, the lens condition for cataract. And so we're very excited to be the first and only center in the state of Tennessee to be able to provide the LensX laser to have the laser cataract surgery for our patients.
And you can call 321-8881, the Wang Vision Institute. We want to thank you, Dr. Ming Wang, for joining us tonight. We appreciate it, and Shirley, continued success with your laser cataract surgery. That's it for us. We'll see you later.